Hey, it's Patricia Murphy. It's Tuesday. This is Seattle Now. It's been 1 year since the first COVID death in the U.S. was reported right here in Western Washington. Now the state is on the cusp of recording 5,000 COVID deaths. It's been a hell of a year. In a minute, King County's Dr. Jeff Duchin tells us why he's cautiously optimistic about the future. But first, let's get you caught up. A manager at Amazon filed a federal discrimination lawsuit against the company Monday. Charlotte Newman says executives paid her less than her white counterparts and passed her over for promotions. Newman, a black woman, also alleges a former Amazon director sexually harassed and assaulted her. Amazon says they're investigating the new allegations and that the company doesn't tolerate discrimination or harassment. Seattle's teachers union has filed unfair labor complaints against the school district as the two sides are still at odds over getting students back to the classroom. The union says the school district went too far by classifying some educators and staff as essential workers in order to get some special education students back into classrooms. The complaints say that interfered with the rights of employees to collectively bargain. The district says it acted within its authority and is moving forward with reopening plans while the complaints are heard. And 11-time WNBA All-Star Sue Bird is staying in Seattle. The Seattle Storm signed her yesterday. Bird is returning for her 18th season with the team. She's led to 4 WNBA titles, most recently last year. Bird is the league's oldest player, still kicking ass at 40. A year ago in King County, there were 18 confirmed cases and 6 deaths from a novel coronavirus, COVID-19. A year later here, we've had 82,000 cases and nearly 1,400 people have died. Statewide, we've lost nearly 5,000 people. It's safe to say most of us had no clue what was coming. King County Public Health Officer Dr. Jeff Duchin knew more than a lot of people, and he's here now to look back at 1 year later after COVID-19 in King County. Dr. Duchin, thanks for taking the time.
I'm happy to be here.
So it's a year, and we're looking back, right? I want to know your moment, the moment you realized you were going to be the person in charge of the 100-year pandemic.
Well, first of all, characterizing me as in charge of this pandemic is bad for a number of reasons. But there were a couple of moments where I realized things were going to be very different and potentially very scary. I would say the first was, when China locked down Wuhan, a city of 11 million people, that was a pretty clear warning to me that something very serious and unprecedented was going on. A month later, approximately, I was in Atlanta at the Advisory Committee on Immunization Practices routine meeting and got a call from our team about a couple of cases that were very suspicious here in King County hospitals, and at the same time, a potential outbreak in a long-term care facility, which we all came to recognize a couple of days later as the Life Care Facility in Kirkland. And because of this, I immediately booked the next flight out of Atlanta and came back to Seattle, where the next day we were able to test the patients in the hospital and confirmed our first cases of COVID-19 locally, one of whom sadly was our first fatality. And from that point, things sort of spiraled. I think hearing about an unexplained outbreak in a long-term care facility, hearing about critically ill patients in the ICU at a local hospital, one of whom worked at this facility also with no explanation. And understanding that, this virus had been identified in Washington state, that there was concern that it might be spreading, even though 75% of the close contacts of that initial case from Snohomish County were traced and tested and found to be negative. Clearly, there were other introductions in this. The realization hit me that, the virus had been spreading silently, as we had suspected it might be. But now we had confirmation, and it was erupting into our consciousness in a big way. It had a lot of momentum at that point, and cases were going to be popping up like weeds for weeks and weeks and weeks, despite our best efforts.
And I wonder, because at some point in the future, this will be part of history the same way the 1918 flu pandemic is part of our history. What do you think people are going to be scratching their heads about in the future, about how we worked through our pandemic?
Well, I think there are a couple of things. I mean, the biggest thing will be why, as a country, the United States did so poorly compared to every other country in the world, pretty much. There was a study, a global health security study in 2019 that looked at the ability of countries to be prepared for and respond to an emerging pandemic. And the United States ranked highest out of every country in overall preparedness because of our wealth, our resources, our sophisticated public health system. But we ranked very low in two key areas: a level of trust in government and access of our public to healthcare, the number of healthcare providers per capita, and the absence of universal healthcare access. And that's a marker for, underlying structural issues in our society that lead to health disparities in general. And so I think that one of the things that people scratch their heads about is why did U.S., the wealthiest nation in the world, perform so poorly? And why is it that whenever we have any sort of natural disaster, we see quite clearly that communities who have underlying health disparities because of longstanding structural inequities that lead to poverty, economic deprivation, environmental issues that predispose to illness, we keep reliving the fact that these communities have disproportionate impact and death and cases, be it a hurricane, a flood, an earthquake, or an emerging biothreat like a new virus. So I think, again, people should be scratching their heads about why we don't take more action to remedy these underlying issues that place so many in our community at increased risk and that are preventable.
There is a lot of reason for hope right now. Vaccines are providing a window into the light that we really need because we're rounding 1 year into this pandemic. Where are we going to be a year from today, Dr. Duchin?
We're going to be in a much better position a year from today. We will have many, many people vaccinated a year from today, and we will have people who've had natural immunity through being infected, and it will make it harder for outbreaks to occur. But this virus is not going to be gone a year from today. It's going to be causing infections probably for many years. For the foreseeable future, it will be causing, I think, significant number of infections. It will cause severe illnesses. And we'll be learning to live with COVID-19 in the same way that we live with other serious viruses like influenza virus. It's impossible to predict exactly what will happen, though, I think, between now and a year from now. And I think, the next couple of months are very critical for us because we have increasing vaccines rolling out, but we also have these new variants that spread more quickly, that can cause more severe illness, and that make us vulnerable to another potentially large fourth wave of infection.
I'm trying to end on a hopeful note, but it sounds like the potential for us to take a huge step back is still really on the table.
Absolutely. We remain very vulnerable to a large fourth wave because of the new variants, because of the increasing activities that are permitted in phase 2. And if people do the type of gathering and traveling that they did before the second wave over the summertime with the summertime holidays, or before the gatherings that we had over the winter with Thanksgiving, Christmas, New Year holidays, which led to those large waves. If we continue to act in that way, I think we potentially will see another very large wave with many cases, hospitalizations, and deaths. However, if we detect that we're going in the wrong direction and we restrict our activities again soon enough, as we get more people vaccinated, that risk will recede and we can open up again. But I think it's, the overall message is very positive. We have highly effective vaccines, super effective, more effective than anyone ever imagined. We're having increasing amounts of vaccines, so we'll be seeing fewer hospitalizations and deaths. But we still have to be careful because there's lots of virus out there. And over time, when enough people are vaccinated, we won't see large outbreaks. We won't see as many hospitalizations and deaths, but we'll still see a significant amount of COVID-19, for the near future.
King County Public Health Officer, Dr. Jeff Duchin, thank you. Appreciate it.
I didn't push the button to start the recording. Dang, I'm holding the dang phone in my hand and I never pushed the button to start. Another lesson learned for the next pandemic. Learn how to use your iPhone.
Seattle Now is produced by Jason Pagano, Caroline Chamberlain Gomez, and Clare McGrane. Matt Jorgensen does our music. I'm Patricia Murphy. See you tomorrow.